So a big story that's been making the rounds the past couple days is that UnitedHealthcare is going to be dropping a few Medicare Advantage plans that about 600,000 people are currently enrolled in. So it's a big headline. It's a scary headline. We're going to talk about why this might not be as big of a deal as you think it is and what you can do to prepare for next year. So again, this is public information. We're just reacting to this, giving you some insight from a licensed Medicare broker here at NJ Life and Health. If you ever need any help with Medicare, life insurance, anything like that, reach out to us, 848-226-6897. But again, we're going to dive into this article. United Health will drop several Medicare Advantage plans that collectively cover more than 600,000 people, part of a broader financial reset as the company grapples with rising medical costs. This is from healthsystemstracker.org, which I believe takes data from, the Kaiser Family Foundation. Our healthcare expenses are going up, up, up as a country. As you can see, even 2 years ago, we spent about $4.5 trillion on healthcare. That number was about almost 4.9 in 2023. I can't even imagine what the dollar signs are going to be for 2024 once we actually go through that. We're also looking at medical expenses per capita is going up, up, up. So in 2023, it was about $14,500 per person, and it's increasing at a very stark rate year over year. So UnitedHealthcare has come out and said we're consolidating our offerings because we're paying more claims, we're paying more hospital bills and everything like that. And we're going to knock out some of our Medicare Advantage plans. In a second quarter earnings call, the CEO said that this is going to primarily affect members in less managed products such as PPO offerings. Medicare Advantage plans are private health insurance plans approved by Medicare that provide an alternative way for people to receive their Medicare benefits. In 2024, more than half, 54% of eligible Medicare beneficiaries, about 32.8 million people, were in Medicare Advantage plans. Medicare Advantage continues to grow, but I think one of the biggest stats, I scrolled down a little bit, is that their medical costs jumped 20% just in this last quarter. So that is a pretty big number. So just to reiterate, they're going to be dropping a few Medicare Advantage plans. The CEO says primarily around PPO offerings, and this is primarily due to a rise in medical claims, medical costs. So I gave you the Cliff Notes version of the article. Medical costs are going up. This is leading UnitedHealthcare to cut certain Medicare Advantage plans across the country, and this is going to affect an estimated 600,000 people. So what should you know about this? Well, this is a big, scary headline like we talked about earlier, but just so you know, they're going to give you a huge heads up that your policy is no longer going to be in effect by the end of the calendar year 2025. So UnitedHealthcare is going to send you a lot of letters and let you know that if your policy is one that is on the chopping block, that you have ample time during annual enrollment to switch into a new policy. And if all your doctors take UnitedHealthcare, if you love the UnitedHealthcare Medicare Advantage plan that you're currently in, you are most likely going to have other great offerings from UnitedHealthcare in your area that will still do virtually the same thing. These companies have a lot of different plans in each area. They say, okay, of let's say these 10 plans, maybe 3 of them don't really work for us. A lot of people aren't enrolling in them, or they're not, the most profitable. So we're just going to phase those out, and we're going to consolidate what people actually like. And that way we can make sure everybody has a better experience. This is why it's so important for you to not only talk with your broker, but also check all the correspondence with your current Medicare plan. We know it is a total pain, and you get so much Medicare mail, and there's so much stuff going on. It can be so hard to process, but you really need to pay attention to the letters that your insurance company sends you, because they could be letting you know something big like this is happening, that your policy is going to be, going away at the end of the year. They could be giving you your annual notice of changes, which is giving you a massive change to your policy, and you may not know it unless you go through it and fully understand what is happening for the upcoming year. So just to summarize everything, UnitedHealthcare is phasing out many Medicare Advantage plans throughout the country. This is primarily due to rising medical costs and just focusing in on policies that they actually like and that their enrollees actually like. If you pay attention to your mail, if you talk with your broker, you should be able to see if your particular policy is getting phased out well ahead of time. They're going to give you a ton of time to think about it, assess your options, move into another UnitedHealthcare plan that is similar in your area to make sure that you can have the coverage that you deserve. We want to know what your thoughts are on this. Please like and subscribe and leave us a comment down below. And if you want Medicare brokers that stay on top of news like this to make sure that you have the coverage that you need and deserve, reach out to us here at NJ Life and Health. We're licensed in over 29 states. You can call our Toms River, New Jersey office at 848-226-6897. or visit our website, www.njlifeandhealth.com. We have a team of local brokers here at our small family-owned business that has helped thousands of people just like you with their Medicare and making sure there are no surprises year over year. I've been your Medicare guy, Ken. I hope you have a great day, and we'll see you in the next video.